Okay, yeah, you've got what me and the roommates would anecdotally nickname cereal bowl syndrome, where basically, like, your spinal erectors, yes, that's a term, grow up internet, are so large that you could eat cereal out of your back. Oh, wow, okay.
Nice.
There we go. Woo! Hey, guys, if you heard that watching, you're legally obligated to like and subscribe, just in case you haven't already. There we go. There we go. Omar, thank you so much for coming in today. Really appreciate it. We had a strong patient in last week, and now I think we've got an even stronger one. This is Omar. He's probably too humble to say that he's the strongest guy at the gym, but he's definitely competing for that title. Omar's in today. He has some flare-up of neck pain. He's got a history of hip issues. Do you care to share a little bit about what we're going to be doing today, what we're going to be focusing on?
Yeah. So basically, my hips are incredibly tight. Now, I'm not entirely sure if it's due to just the muscles or the fascia as well. So I'm definitely trying to get it looked at so I can be more mobile and be more comfortable while lifting heavy. My quads also, and like the tip of my knees, definitely scar tissue in there.
Okay.
I'm trying to, I guess, break that up so when I am doing legs, I don't feel held back through like the pain that I have as well.
So currently when you're hitting legs, like if you're hitting a heavy squat or something, are you saying you're getting that knee pain?
Yeah.
Okay.
Like I would definitely.
All right, and then you mentioned scar tissue. I know we talked about this off camera, but just that people watching know. Like, did you ever have like serious trauma to the knees, or is it just what do you think it might be from?
No, I honestly think it's through like repetitive use.
Okay,
Through,
so
like,
a lot of basketball,
jumping,
weightlifting, plyometrics, stuff like that. Okay, very fair, very common. So I already actually felt his quads, and they're probably the tightest quads I have ever felt in my 3.5-4 years of practice, which is saying something. I'm not supposed to tell you that because technically it's a bad thing to tell a patient that.
I probably already knew that. I told her when I was coming in, I'm like, I'm gonna be probably the top.
I was like, all right, try me, no problem. What have you done thus far? Like, I take it you've probably seen other physios or chiros or whatever for the quads and the hip. What have you done for it in the past?
Yeah, Chiro for the hip.
Okay.
Basically, I had some pads on there as well.
Some
I forgot
pads.
what you call it. Yeah, it was the
like TENS units?
Yeah.
Okay, yeah.
So I did that, massage therapy a little bit. But basically, like, that's it. It's more so, I feel like it's something that I also have to sustain myself through, like, rolling and obviously, like, coming here, seeing you, to help, like, sustain that looseness through the quads as well, too. So, like, partly it's obviously my fault, but partly, again, it's
not really your fault. It's kind of biology's fault, right?
Yeah.
Like,
Bar too.
yeah, like you rub it with a. We brought Shannon back today.
No.
Shannon was on last week. They're married. It's beautiful couple. But okay, so sorry you.
No, like a barbell.
like, yeah.
It's intense. It hurts.
You
It's
use
crazy.
a barbell to.
Yeah, like I put the barbell on like my quads,
You just
and
let
like
the weight
I
of
let
the
the weight of
barbell
the barbell
literally
just.
I thought what I did was torture.
No,
Okay.
No, it gets
torture.
crazy.
This is literal torture.
Yeah.
Okay.
It's a half barbell, so it's
Yeah,
not
like a
45,
shorter
one.
but it's
Okay, yeah.
enough.
It's more than enough.
All
Sometimes
right.
you gotta
If
like.
you wanna try it. If you want to see me cry, that's what I'll be doing.
Yeah.
in the gym.
No one wants to see you cry, Shannon. Okay. All right. So you recently turned 31. Okay, we're the same age. We're both 94 babies, or maybe
I'm
you're
still
30. Yeah, okay, still 30. My bad. Still 30. My bad. I have never needed to focus more on my own mobility than now. Okay, us millennials, we're hitting that age where we definitely do need to take it a little bit more seriously. I know when I was a young, arrogant prick, I used to laugh at the older people in the gym doing like the really slow, simple moves, like, just go lift weight. No, they had it right. Who would have thought? Yeah, you're right. So some of the onus is on you in terms of making sure you're stretching out, you're taking the time with that. You also mentioned, like, coming here. You're right. You should everybody should be seeing a manual therapist of a sort. It doesn't have to be a chiropractor. It could be a massage therapist. But you got to find one that works for you. The things that you've mentioned sounds like you've tried to address the muscles, stretching it out. Great. It doesn't sound like you've addressed the fascia too much. So that's what the tools are, and we're definitely going to be dealing with that today. I'm going to request that you try really hard not to kick me as we do so, but I think you'll be okay if you're literally rolling barbells over your quads.
Yeah.
All right, so then also Shannon mentions that you had a flare-up of your neck recently too. What happened there?
Honestly, it was probably the way I slept.
Okay.
I'm not entirely sure.
Oh, so you
what
woke up
happened.
with it?
Yeah,
All right.
I woke up with it. Kind of like the same as hers, but not as bad.
Okay.
Definitely not as bad.
You guys got a lot in common. Huh?
Yeah, no,
Okay. Left side, right side?
Left side.
Left side, okay. It's been improving though?
It has been.
Good, okay, that's good to know, good to know. Anything in the upper back at all, or is it really just kind of those hips and that neck?
Honestly, I'm going to say my whole body
Dude, we can scrape the whole body, that's fine. That's
my whole body needs work.
Okay.
To be honest, like, I wouldn't count anything out.
Okay.
Like,
so we'll screen everything then,
Yeah.
and then we'll probably end up working everything. I know, like, I wasn't kidding when I say he's a really strong guy. I've seen him, what was your deadlift when we were at that competition?
600 almost.
like 595.
595, so like heavy weight. That's a lot of stress on the body, and I know you work out regularly, which is great. It's incredibly healthy, but we're gonna obviously get a couple of ailments with that. So we'll look for all of that. Any questions before we get started, or are we good to get into it then?
No, I'm just excited.
Perfect. So, me too. You guys too. Awesome. Let's do it. Right. So Omar was commenting that he's got really tight hips. I'm here poking the quads again, and they're still tight. Maybe about 3 minutes later, surprising absolutely nobody. Omar, do me a favor. Point to your hips for me. Good. Okay, so he's actually pointing to his hips. That's the first thing that I need to ask a lot of my patients, because they will say their hips and then point to their low back. It's important to clarify. So you're talking about right there.
Yep.
And right there. Do you have a high pain tolerance, would you say?
I would say it's decent.
Okay, good, because I'm poking in there rather firmly, and you're not even flinching. All right, I gotta bring this up. All right, we've got good hip flexion. We're able to get up in there. Do you get any pinching in the hips as I come up here? No? Awesome. Let's bring it here. Let's check our internal range. Okay, so that's internal range of motion. I'm trying to rotate his hip internally, and we get maybe about 10 to 15 degrees, which is not that much.
I should mention that I have taken an x-ray and have found out that I do have calcification in my hips.
Within the hips there.
Yeah, that kind of stops the...
Okay. Now, quick question with that x-ray.
Yep.
You found out that it was within the hip. You might not know the answer to this. The calcification, is it in your tendons, like the hip flexors, or is it within the hip capsule itself?
I think it's the hip capsule.
Hip capsule itself. Okay. All right. Now let's go the other way here. I'm going to go ahead and bring this apart. Oh, do you have it, Shannon? Do you have the actual
I'm
report?
gonna look and see
Awesome.
if I can find it.
Is that okay? What do you feel? You look like you might feel something.
Yeah, I do.
Where?
It's more so uncomfortable. Yeah,
Just kind of in the groin region there. Okay. Let's go ahead and do the other side. And internally rotate. Okay, so we've got a lot more internal rotation on this side. Do you find that the left hip is worse than your right?
The left hip is worse.
Okay.
Yeah.
Here we're able to get to our 45 degrees of internal rotation, which is usually what I like to see. Now let's go ahead and drop this down. Do you get that same pulling in the groin, or not as bad on this side?
No, the same thing.
Same thing? Okay.
Yeah.
And then we'll come on up here. We've got good hip flexion in through there too. Awesome. Okay. So definitely worse on the left side, possibly due to the calcifications that are within that hip capsule itself. We're waiting on the report. I'll give it a read through and then confirm or deny that. And then, okay, so again, I have a really hard time believing that you're not actually engaging your quads right now.
No.
Okay, because they're like rocks, legit. So we're definitely going to beat those up in a bit. All right, so let's go ahead and feel on through Omar's back. Oh my, is it just every muscle on your body that feels like a rock?
I'm telling you right now,
Yeah.
it's everything.
Okay, because he's got, okay, yeah, you've got what me and the roommates would anecdotally nickname cereal bowl syndrome, where basically, like, your spinal erectors, yes, that's the term, grow up internet, are so large that you could eat cereal out of your back. Like that's the joke. Well done. Okay, incredibly strong. Jesus, I'm a little worried I'm not going to be able to adjust through this.
That's crazy.
That's I've never said that out loud before.
That's so funny.
When I do this, is that okay on the hips?
Mm-hmm.
Okay, good. Or maybe like rock climber syndrome, because it feels like, like a rock. I gotta stop flattering you, man. I feel like I don't want to pump up an ego here. And the funny thing is, your traps are actually the least contracted out of every other muscle on your body, which is like the area that's usually the most tight on people.
Honestly,
Make it make sense. Yeah.
I made my wife dig into them recently, so.
My elbows.
Really? Okay,
Yeah.
good. That's exactly what I do, right? So that's good. Good job. Maybe you could be a chiro assistant.
Maybe.
All right, we're gonna try to adjust in through the upper back here. If it doesn't work, whatever, we'll get into the scraping. Okay. Take a breath in for me, Omar, and breathe it all the way out. All the way out. Oh, wow. Okay.
Nice.
I'm good at my job. Thank God. Okay.
Go.
Good job relaxing there. Was that painful at all, or how did that feel? That was okay.
No, it was great.
Okay. One more breath in. All the way out. Yeah, we got it all with that one. You had your low back worked on like this before? Familiar position for you?
I think so.
You think so? Just been a while?
Yeah, it's been a
Okay.
while. It's definitely been a while.
All right. So what I'm going to do here is I'm going to roll your whole body towards me, and you're going to try to relax as much as you can. I promise you're not going to fall off the table.
Yep.
Here we go. Well done. Okay. Good. Breath in. All the way out. Roll the whole body toward. Yeah, help me out. Just roll your body. Thank you. There we go. Good job. Omar was saying that his left-sided neck has kind of flared up from sleeping in a weird position as well. Was that kind of higher up in the neck or lower down in the neck?
Lower down.
Lower down? Okay,
Yeah.
so let's start down there. If I find a particularly tender spot, let me know, but something tells me that pain tolerance is going to make that difficult.
Yeah.
There? Or are you
Yeah.
saying yeah to the pain tolerance?
Both.
Both, okay.
Yeah, this one's pretty.
So we're at about C5, which is the fifth cervical vertebrae, so not really that close to the top, but we're going to go in and check it anyways. That seems okay to me. Let's check the right side now, and then we'll get into it. Just relax into this hand, lower down. Good. Woo!
Yeah, a big one.
That was a huge one.
I couldn't even hear it.
You didn't hear that? Okay,
It was
you'll.
banging.
Oh, okay. You'll hear it on camera. Yeah.
Probably.
Hey guys, if you heard that watching, you're legally obligated to like and subscribe, just in case you haven't already. It's that red button underneath the video. Helps me pay rent. Thanks. Okay, same deal. Just drop and relax into this hand. There we go. There we go. So we're about to do something that I don't do too frequently on this channel, which is the scraping technique on a patient's quads. Now the reason that I typically don't do this on the channel is because it usually hurts like hell. And for that reason, I don't want to scare any of you watching thinking about coming in. So Omar's got a self-proclaimed high pain tolerance. We're going to see if that's true or not. So again, if this is too much, please just say stop, okay? And I will stop, I promise you.
Okay.
Okay, we're starting with the warm-up
Challenge
tool.
accepted.
All right, so this is not the crowbar. Yeah, this is just the warm-up tool. Okay, so far?
Yes.
Good, good, good.
I want to watch this.
By all means.
Big front row
Ladies
seat.
and gentlemen, his wife. Okay, that's great.
Hey.
Yeah.
Hey.
So I would actually wonder, the hamstrings feel okay. All right. Yeah.
Yeah, I feel like my hamstrings are alright.
So it's usually around this point of the appointment that I like to ask the patient stuff about themselves to give them a chance to kind of interact with the audience or give an audience a chance to connect with them. Omar's got a really, really cool job, in my opinion. And that's something that I guarantee at least a handful of you guys watching have thought about being able to do. And maybe only one or two of you would be able to. Omar, do you care to share about what it is that you do and what you teach?
Yeah, so basically I day trade stocks and day trade the S&P 500 options. Generally the workday looks like anywhere from 6:50ish. I'd probably be up and ready to go, and then I'd be trading anywhere from 7 to whenever I hit my first trade. So for example, if I don't get a trade, max, I'd probably be working till maybe 12:30 or 1. I'm a little bit more attentive this time around because of just all the macroeconomic stuff, geopolitical issues and so forth that are going on in the market. So I gotta actually be watching the tweets and so forth.
So it's funny how so much financial info can be derived, or rather inferred in this case, based off a single tweet.
Yes.
right? Like you get a tweet, and then that's going to swing things. Or in your term, I recently learned this term. It can cause like a red candle. I know that's he's. It stopped recording.
No,
Oh, it's still going. Oh, it just came off the. Okay, you keep watching that, Shannon. I thought it came off the
No, you're good.
computer there. Red candle, just because somebody says something online, like emotional. But it's you seem like you've been doing well. Would you recommend just anybody gets into it, or?
I mean, it depends on like who you are, your personality, and your learning style. I do believe that everyone can get into it.
I'm sensing a butt. Is there a butt coming?
But
There it is.
it just depends on, I guess, yeah, like how quick and how psychologically how good you can be with your emotions and discerning what traits to take and what you shouldn't.
Very fair.
But for the most part, all of that is generally gained and earned, right? And you find out a lot about yourself where it's day trading and how disciplined you actually really are. So that's another thing.
Well, I'm going to go out on a limb and say that you're extremely disciplined because I'm putting quite a bit of weight into you right now, and he is just not even flinching. Like, I'm actually a little scared of you.
It's crazy because I think the bar is this times maybe like 5. Just the bar.
I would agree, even though I haven't had that done. My issue with this is I would just get tickled.
Yeah.
I would just be uncomfortable.
It's more so another type of sensation.
Yeah.
Well, now I just feel emasculated. Okay, I gotta press harder, I guess.
Yeah.
Yeah, you're getting a lot more redness on this side, actually.
Interesting.
Weird. Forgot to scrape like the tops of the knees more, so I did a little bit, but not as much as I would have liked. But it's good to hear that working up here the quadriceps really helped out that quadricep tendon more so. We can kind of expect that, but it's nice to actually see it. How's the neck feel? Does that feel like you got more range of motion than beforehand?
Definitely.
I didn't realize I also forgot to test range of motion. You can tell, this is actually my last appointment before going on a 2-week vacation, so I'm a little apparently I'm a little messy, but that's okay. Did you have any other questions for me at this point in time? I had a question for you, which I just remembered. But did you have any other questions for me at this point in time? No pressure if you don't.
Like I
Okay.
don't feel like I have any jarring questions.
Okay.
I think for the most part, like you've been awesome. So.
Oh, well, thank you. I'm flattered. My question for you that I kept forgetting to ask you through this appointment, yet another thing, would be what your hip mobility routine actually looks like. Like, what are you doing before your workouts or during to try to free them up?
Like, I generally like stretching with weight. So if I am doing basically a like pigeon stretch, it would be like seated.
Okay.
Or sorry, like elevated with a bench. Like if I'm doing pigeon or if I'm doing sort of like a butterfly stretch, it'll have like weight on it. Because I found that generally stretching with weight has given me like a lot more, honestly, more so flexibility, not necessarily mobility. Right, so. Yeah.
So my question there, do you do an additional follow-up to that? Do you do anything for what we found to be the reduced internal rotation on that left hip at all, to the best of your knowledge?
So I'm going to say no. The reason being is because it doesn't necessarily... I went to physio for it before I had the x-ray.
Yeah.
And like, whenever I was working through it, it didn't feel like a stretch or mobility. It just more so felt like a...
Like a hard...
a hard stop and a little pain.
Okay.
Right? So I kind of, strayed away from doing mobility things like that because like I'm not entirely sure if that's actually better for it or if I'm actually just making it worse or just doing nothing.
Yeah. Right? Okay. Anytime you get that hard end range, it can be due to either calcifications or something literally hard in the way, degeneration in some cases. Did you ever, and this is my last question I think, for that internal range of motion with the physio, did you ever stretch through that while traction was simultaneously being applied to the femur? Like while something was pulling this leg almost out of socket, not actually out of socket, but almost out of socket, and then internally rotate?
No, it was, what the heck do you guys call it? Like not disengaging, but I don't know, something. I had like a band
Mm-hmm.
or something really hard
Yeah.
to kind of pull the
Traction
muscle.
it, okay.
Yeah, while
Okay.
doing that. That's what I remember.
Do you find that, and that probably, well, clearly it didn't help or it would have been fixed,
Yeah,
right?
like I feel like it was weird because I feel like it did kind of help, but at the end of the day, it's like I don't know how well I could have done it because like the slight pain
Yeah.
like that I got through it.
So definitely gonna want to get that report when you can, depending on what it is. Shockwave
Yeah.
therapy could be good. Maybe we do need to just push through that wall. I don't know until we read the report, but I'm excited to follow up with you. I genuinely
No,
am.
me too.
All right. Well, thanks for coming in, Omar. Really appreciate it, and I'll see you soon.